and has moved up the North Shore, now has a brand new hospital they're building from scratch in Lake Forest, outside of the downtown, I will mention. But certainly, I think they make the case that there's like-minded vision. I think a skeptic might also point out their coverage area has expanded to cover the most affluent parts of the entire Chicagoland region that probably have the highest rates of insurance coverage as well. Nonetheless, we see the breakdown in their current organization: Northwestern Memorial Hospital, CDH Delnor Health System, the Northwestern Medical Group, Northwestern Lake Forest Hospital, and the Northwestern Foundation. Cadence has set up a foundation. Senator Page has its own foundation. So this is a simple, higher level one. It gets more complex. We can go to the next slide. Now this is just with the CDH Delnor organization under the last 2 years is Cadence. And interesting to see they break into non-for-profit entities, but also break out for-profit entities. And it actually is the hospital itself, the nonprofit, that by far and away generates the biggest bucks, which are, again, just unbelievable. But the for-profits, who we talked about for regulatory reasons, these are broke out, but also for financial reasons. And trying to decipher the 990 federal tax filings that the hospital is required to make, by no means would I say we have an expert grasp on that. I think we probably need some professional assistance to really get that kind of a read. But we have been able to get down to some of the key financial sections of those very thick documents. One of the things that stuck out to me, the insurance entity under their for-profit side is based out of the Cayman Islands. And so that seemed unusual to me. That would seem to suggest it's maybe for tax reasons or something. It would be, to me, something I think we should understand better. But the arrangement and the complexity of this certainly goes beyond thinking of them as a high-quality health organization with a great hospital. And certainly the village only has so much staff here. Really looking at the professional staff here, we're doing the best we can to get a read on this. Let's go to the next slide. Hospital leadership. I'd mentioned we've repeatedly requested information on who is on the board that governs Senator Page Hospital. And the hospital has repeatedly declined to provide that information to the Village of Winfield. What we have been able to find through other research efforts is a listing of the hospital, Northwestern Memorial Hospital Board of Directors, which our understanding is calling the shots for all of the hospitals in their growing system. You look at the names, it's a who's who of VIPs from Chicago, from the city, that serve on the board that's governing the hospital in Winfield. The chairman is Edward Liddy, and the numbers of Sullivans, of Pritzkers, Brodsky, these are some big names, running law firms, running investment firms. One's the head of the Chicago Council on Global Affairs, another's the leader of the Northlight Theater, CBR Holdings Investment, another's the leader of Exelon Energy Corporation. So certainly people who in their own right have some very big demanding jobs, but also I think in more of a volunteer basis, I assume, serve on the board that governs ultimately the biggest decisions made by the hospital administrators. I think truly, though, it is at the administrator level where all the day-to-day and even beyond that type of decisions are left to be made. And I guess when we're not getting answers to fair questions, we start to question that arrangement. But as far as the full-time CEO types, we see Dean Harrison as the president and CEO of the overall Northwestern Memorial Healthcare System. Brian Lemon is the president of Northwestern Medicine Senator Page Hospital. That's the highest official we've been allowed to deal with in our efforts. Since the Northwestern merger, Northwestern has had their top governmental relations person sitting in our meetings. I would suggest there's been a change in tenor and perspective of what their relationship should be with the community that I find palpable since it's become a Northwestern entity. If we could switch to the next slide here. Let's get a little deeper into how the financial arrangement exists for nonprofit hospitals. The most, starting at the federal level, I want to highlight what does it mean to be nonprofit tax exempt? It means you're exempt from federal income taxes on income that your entity brings in. It also then, if the state extends that, which is not unusual, you're also exempt from the state income tax that would be charged on a corporation. That also then can extend to the sales tax that typically would apply to an entity in the state. And then, most notably for Winfield's situation, it extends to the property tax that is levied in Illinois. The criteria are a little different at the federal level and the state level. What we can tell you about the most recent legislation in the state of Illinois, as best we understand it, hospitals to qualify and maintain their tax-exempt status need to be able to demonstrate on an annual basis that the value of the charity care they give equals or exceeds what the value of that property tax exemption is, which would really just be in Winfield. So to clarify that again, they can add up at Senator DePage Hospital how much the value of charity care they give anywhere in the region here, and as long as that exceeds the tax exemption they enjoy in Winfield, they get to keep their nonprofit status. To understand that legislation a little better, we continue digging. The best we can make of it, this actually was a tag-on bill to the latest tobacco legislation and was worked really, I think, out of sight of representatives for towns with hospitals weren't really at the table, the best I can tell. I think the Northwestern rep we've talked, boasted about his involvement crafting the way that law works, and I'm sure that they were very involved with that and knew the right legislators and worked out something that was in the best interests of the hospitals they represent. I can tell you the village at no point was involved in understanding what the impact that could have, but that is the legislation that exists, and that legislation defines how the hospital establishes its own valuation, which then leads to what their tax exemption is worth and therefore determines what charity care level they must be able to demonstrate to continue enjoying that tax exemption. That's my best effort at explaining that, and I think we probably, with some help, can find someone that can do that better, but I think that's pretty clear for purposes at this point. Let's move forward. Certainly, I don't want to suggest that it's an independent hospital that lobbies. Actually, I believe that is against the law to get involved with campaigns and formal political efforts. What the hospitals do is they team up within the Illinois Hospital Association, which is their lobbyist group, which is able to do that sort of thing, and I think is widely regarded as one of the strongest strongest lobby entities that does work in Springfield, have a lot of pull. And we're not trying to get in their way here, but we are asking questions to better understand just what are we dealing with. Okay, I want to get into this next page, and this starts hitting home. We're looking here at foregone property tax estimates for both the overall community of Winfield, that includes all taxing bodies, as well and specifically for the village is really what we're talking about. But I think to truly understand the picture, we need to have all the facts. And what we see here actually is that from our best estimates, the value of the Senator DePage Hospital campus and buildings far exceeds the value of our entire town. And so for tax purposes, that means that the majority of the value in Winfield is off the tax books. And so when any government levies, all of that burden is falling on just the people who do have to pay property taxes. And that's an extraordinary situation. What the breakdown, as best we can tell it, is for such a small town to have, you don't find towns with something approaching 2/3 of the property value up. I would like to ask the finance director to give a little more detail before I go further on how we did this. And of course, the first thing we did was to reach out directly to Senator DePage Hospital for information from them on their valuation. We've repeatedly made that request and repeatedly been declined. And the best we've heard is that there could be some information they could share. We've begun our requests last month and more recently last week and haven't had any assistance with this. So we're doing the best we can looking at their tax filings to come up with a fair estimate for purposes of discussion, but it's not through any assistance from the hospital. My best take is they don't want to talk about this. But if Finance Director McCammon could please go through the methodology we used here.
Thank you. Yes, as you mentioned, obviously we had reached out in several different attempts to try to get an assessed valuation, which would be the most accurate estimate. But absent that, we did a little digging and decided, well, how could we go about this? So our first look was to go to the CDH IRS Form 990, just for CDH, and we had one as of June 30th, 2013, and we picked up what their asset value is. So, but it's important to understand that that asset value is recorded at mostly at historical cost. So just like we don't pay property tax on what we paid for our house 25 to 50 years ago, we ran that estimate, but obviously that's going to be a little on the low side. So then we thought, okay, well, how could we get it up to current assessed value? So we tried to base it on some type of published statistics. So we took the Bureau of Labor and Statistics historical annual CPI inflation rate. Then we looked at CD's history of when they purchased the land, when they, in their own wording, it said they doubled their campus by 1970, so we took another rate at 1970. And then we know during like around the 2010 period, they had a significant expansion. So we took most of that. We created a blended rate based on those time frames and determined what that value is. So we then took the high and the low and actually averaged it to try to give a somewhat average, because we recognize that possibly the CPI inflation, it's just a blended rate based on our best guess. But that's why we took the average of those two rates that we got, and this is what we came up with. So then we applied the assessed valuation to the current tax rate for the village and for the community as a whole.
Thank you. So to boil that down, because it bears repeating, all that the hospital needs to put on their 990 is at cost. They add up how much it costs to build this section of the hospital in 1962, how much it costs to build this section in 1968, 1970, so on and so forth, at cost. So they don't have to show what something they built 40 years ago would cost today. The value they put in their tax forms only has to show back then. Well, that's a bogus number to get at what a true value is. That would be like saying the price you paid for your home 25 years ago is all you'll be taxed on for property taxes today. That's just not how it works. So to get a much more realistic number, we added in the historical inflation rate, looking at their growth as best we could, timing up what happened also over the course of time with inflation to get a modern day value. And we would freely admit, without the assistance of the hospital, we could be off. But looking where the ballpark is, it's even if we're off a lot, it's still unbelievable. So we took that high end and the low end, which is the number they put down, and we averaged it to get a number in the middle. And that's the basis for what we've got here on the screen. What this says, for the tax year 2014, the village equalized assessed valuation, so the EAV, what the county assessor will tell you, all properties in Winfield are worth just under $300 million. based on our methodology, the best projection we can make about Central DePage Hospital is all of their properties, buildings, et cetera, on their campus add up to almost $430 million. So the rest of this town value $300 million. That campus value, which is generally mostly off the books, is $430 million. What does that mean, truly, to this community in Winfield? By our estimates, if CDH paid property taxes, the revenue that would come into all taxing bodies in Winfield on an annual basis would be about $42 million that we're going without. That's the overall value of that tax exemption they enjoy. That's the subsidy, in a sense, that what they don't have to pay to all the governments in Winfield. Again, we're not trying to make the case that they should pay all the school taxes because they don't generate kids into the school system, et cetera. We very definitely feel that the village services they fully enjoy, and there is a strong argument they ought to be making a fair share contribution to those services that they utilize. In the case of just what the village government share of the property tax would be, it comes out to $1.7 million a year they go without contributing. Now, if you remember earlier in the presentation, we broke down what they do make in a donation to the village government annually. It's averaged about $200,000 a year, whereas if they were on the tax rolls, it would be about $1.7 million a year. So that's quite a gap. We'll get to the next slide. We talked about the nonprofit status and how it's tied into their ability to demonstrate charity care. And this is a whole different way to come at and look at this. Again, I'd mentioned in one of the early slides, CDH had publicized what figures they projected for the charity care in Winfield. So we asked, formally requested that for the other towns they service. So figuring they're publicizing it about Winfield, it's a fair question for you to give us those numbers for the other towns. We are able to get their charity total figure off their 990s. They would not provide that information either, and I think that's another head scratcher when you publicize Winfield's but won't share any other towns. That doesn't make sense. But nonetheless, using the total figure off their income tax filing, we simply break down the towns in their service area, and that's identified off their website. Of course, it's the closest towns. There are some outlier towns that they also serve, for example, St. Charles, Geneva. Many of those people would go to Delnor, but some of them, for one reason or another, come over to CDH. But looking at the closest towns that clearly are primarily in the CDH service area, we took the total charity care number they reported to the government in their tax filing, and we broke it down by population in just those closest towns. And what we end up coming to is, you see, the free care figure. So this is coverage for people that come in from any of these towns and don't have health insurance. And this is in millions of dollars. In Winfield, that was just over $2 million for the most recent year. Carroll Stream, it was $4.5 million. West Chicago, $3 million, and on down the line. Wheaton was about $6 million, so about 3 times what ours was. Grand total at the end, $26 million in charity care to people in their service area from all these towns that don't have insurance coverage. The other item, unreimbursed Medicaid. So people in poverty that have Medicaid coverage, the hospital is able to write off the difference between what Medicaid reimburses and what they estimate their costs to be at the hospital. And that amount in Winfield, they've stated, was $1.8 million in the most recent year. Moving down the line, it was about $6.5 million. Interesting just to see some of the variation here. And again, the hospital will not give us this data, so we're using the best methodology we can. You get at the end a breakdown, which we do know is accurate, off of their tax filing of $36 million. And you add those figures together, it's $63 million in charity care. Well, that exceeds the $42 million in tax savings they had by not having to pay property taxes in Winfield. But what does that mean again? Let's put that in perspective. All these towns benefit from the charity service the hospital provides. Can we go to the next slide? But all the burden financially falls on Winfield, which is the one town that has to deal with the tax-exempt status. And so that looks way out of kilter. And so when we talk about a one-sided arrangement, this is what increasingly is becoming clear to us, that we're having to find out on our own with little help from the hospital system. And so this breaks down based on the charity care, the benefit from all the towns in their service region. We show the charity care in Winfield, and then we show what this community is going without, that $42 million on an annual basis. And while that may be the way the latest state legislation got worked out, I think there's a very real question of if that's fair. Let's move to the next slide. We dug deeper into the 990 filings to be able to break down what the revenues are for Senator DePage Hospital. We will place this on the website so anybody who's looking for a copy of this will have access. The top line going across is the net patient revenue reported in their 990 filings. It's huge numbers. They're averaging, over the last 5 years, they bring in about $750 million a year in revenue. They have lots of costs, no question about it. So what is the revenue after cost? The net profit. This middle line is net profit, revenues minus expenses. We see, looking at the average, over the last 5 years, Senator DePage Hospital has averaged $160 million net profit after expenses each year. So that includes the charity cares built into that. They still are left with $160 million of profit at the hospital a year. The village receives a donation during that same time frame of about $200,000 a year, while they're making $160 million profit a year. Next, we calculated the profit margin, and what we see is the lowest furthest year back was just under a 20% profit margin. The averages actually are much higher, pushed almost up to 25%. They've averaged a little over 22% profit margin, looking at their revenues versus expenses over this time. Certainly an extremely healthy profit margin for any kind of a corporation. This information comes out of Cranes, Chicago, except for the most latest year, which we're getting off of their 990s. I would expect Cranes will update their listing shortly, and then we'll have that year as well. Just this week, as we've continued going through the 990s, maybe I came across the biggest surprise, and that was looking at the cash and investments that are that are available and unrestricted to Senator DePage Hospital. The unrestricted net assets, and this is the CDH and Delnor system for this report, but we know that CDH has upwards of 4 times as many patient visits as Delnor. It's by far the larger of the two in the network. But the total unrestricted net assets, what assets are available that they're sitting on? In 2014, $1.87 billion. So based on their average profit, the hospital will top $2 billion in funds they're sitting on at the end of the next 12-month period. And so that's, again, when we look at the belt tightening and layoffs and things that the community's gone without, we look at how much of the downtown area is off the tax rolls, And we look at, from the best we can tell, by far the majority of properties overall, property value overall is tax exempt. In Winfield, by being this hospital town, it's a tremendous burden on the people that do pay taxes in town. And at this point, that would conclude our research to date. I would certainly acknowledge that some further expert help could inform the fact finding, and I think we have some thoughts on how we could move through that, have a little more focused approach. I want to recognize Lynn McCammon. We've been running around crazy pulling this together and making sure the numbers are backed up to the best of our ability. It's been particularly challenging without some responses to many of the questions we've been asking of the hospital. We hope that will change, but with that, I guess I would open it up for any questions from the board. Thank you for your time. I apologize for the extended presentation.